This is the X-ray of the leg that was done a year ago, and she's had a TTA procedure done here. It was done at another vet hospital. It looks okay, but she is quite sore on this side, and she came to me to have a stem cell therapy done, and she's actually gone very well after that. So this left side is now no longer a problem. And at the time when I x-rayed her, she had quite a lot of osteophytosis. That's quite a marked arthritic change. The trochlear ridge here has a lot of bone on it. There's a big osteophyte growing, developing on the back of the patella, and she has an effusion, so she's got fluid in her knee, and other signs associated with chronic inflammation. So we treated her with stem cells, and she actually recovered really well on that side. Subsequently, and this isn't all that uncommon, she has ruptured her right cranial cruciate ligament, and a lot of dogs, when they've done one side, will often go and rupture the other side. So this is her right knee, and at the moment this knee has no significant changes there, other than the fact that she has ruptured a cruciate ligament. So I'm going to measure this knee to do a TTO procedure, and that's a procedure where we are changing the biodynamics of the knee so that you don't need a cruciate ligament. It's not a stabilising procedure, it's a procedure that's changing the way the knee works, so you don't actually have to have a cruciate ligament. In big dogs, it's a lot better to do this procedure than it is to try and attempt stabilisation type procedures. They just don't work as well as things like a TTA or a TTO. So Brooklyn is going to have a TTO. So I'm going to measure her knee to get the angle of the tibial plateau and the changes that I need to make to that. So I measure her patellar ligament, 4.8 centimetres, and then we measure her tibial crest osteotomy. So we go 4.7 centimetres and then up to, so it's about 5.8 centimetres, and that's a fairly sort of expected measurement in a dog of this size. And then I'm also going to get her tibial plateau angle. So this is parallel to where her tibial condyle is, and then I make another one at 90 degrees to that. Actually, this looks like that is probably more like her angle. Probably better there. Okay. It's around about 16 degrees. So that's quite a big angle, 16 degrees. In dogs of this breed, that's a possible angle, but I'll probably use a wedge angle of 16 degrees as about a maximum for this dog. So she'll have a 16-degree wedge. So she'll actually have a wedge of bone taken out down here in her tibia to adjust the tibial plateau to make it so the tibial plateau becomes flatter in relation to the the femoral condyles. So that makes it possible for her to have normal function of her leg without actually having a cruciate ligament. And so we also have a temperature which has a reading at the moment. This is the temperature read. I'll come up with that in a second.